A new study finds that depression is linked with prediabetes or poor metabolic health. In today's show, we're going to break down in a quick format this paper titled Association Between Depressive Symptoms and Prediabetes. This is data from the NHANES dataset from 2007 to 2016. Now, as we've talked about before, epidemiological studies have their limitations. We're relying upon food frequency questionnaires and so forth. But what this survey found is there's a high correlation with prediabetes, which is a sort of multisyllabic way to characterize poor metabolic health. As we've talked about, diabetes doesn't exist in a binary setting where you either have it or you don't. It's a spectrum like all different conditions. You don't just one day get high blood pressure, you're getting pre-hypertension and pretty soon you're into diagnosable hypertension or having high blood pressure. Diabetes is much the same way. You could even argue that depression exists on a spectrum. Some people have major depression, some people have periodic melancholy. And it turns out that when you have poor metabolic health, that affects your immune system and that affects your neurotransmitters, your brain chemistry, and is associated with depression. So having prediabetes or poor metabolic health is not good for mental health. And why is this important? Well, when it comes to the leading causes of death and mortality in people under the age of 40 in this country, mental health issues, including drugs and drug overdoses and suicides, are the third leading cause of death in young people. And so I think it's important that we just remember to get back to the basics. So many people say, I'm depressed, I'm going to therapy. But how many therapists, with all due respect to therapists, I think it's amazing that people are getting therapy, understanding their habits and their patterns and so forth in relationships, in interactions with peers. But what about their metabolic? What are they eating? What's their diet look like? What's their exercise plan look like? I think that is really important. And so this evidence suggests that severe depression symptoms and trouble concentrating are specifically linked to elevated fasting glucose levels. A lot of young children now, and we've talked about this data from the Journal of the American Medical Association that found that about 67% of the calories that young people eat are coming from junk food. So then these young people can't focus in school. They go to the doctor. What do they put on? They're put on a stimulant known as Adderall or Ritalin. These are amphetamines that dramatically alter brain chemistry and behavior and have long-term health consequences. Why aren't we focusing on encouraging that these people eat more healthy whole foods and start exercising? Because we know that trouble concentrating is linked with impaired fasting glucose levels. And also, it appears that depressive symptoms have an association with hemoglobin A1C as well. And so just so you understand sort of the methodology here, this data set included 7,467 participants from the National Health and Nutrition Examination Survey, spanning 5 rounds of surveys between the years 2007 and 2016. And it appears that there is a strong correlation with prediabetes, poor metabolic health, and major depression, as well as the inability to concentrate. And I'll just share just an anecdotal story here, because I took Adderall in college. My metabolic health in college, especially my first year in college, I was eating at the cafeteria. We were going to Taco Bell, with my fraternity brothers, having chips and all this stuff. I was just not in a good place. And I found, back then I was a kinesiology major before I switched to biology. I couldn't focus in school. I couldn't concentrate, couldn't focus. I was falling asleep. Could that be sleep issues? Could that be partying? Yeah, but it was probably just all the junk food that I was eating. Here's an image here. You can see my face. I was definitely over fat and metabolic health was not good. As I started to change my metabolic health, I found that a friend of mine, a fraternity brother, gave me some Adderall, and I found that to be helpful. But also, I realized this is a slippery slope. Taking amphetamines, affected my sleep. I was up all night, heart racing. Could I focus and get better grades? Yes. But I knew that long-term, this was not a viable strategy. I didn't want to be dependent upon this stuff. So I got that out of my life and just really started to focus on eating more whole foods. And I would go to this local nutrition store. It was a co-op in Flagstaff, Arizona. Was just cooking a lot of my food from scratch, not eating at the cafeteria. And out of nowhere, just got on the dean's list and I got straight A's and switched my major to pre-med and biology. And so this is an anecdote N of one. I'm not saying that this is going to happen for everyone, but there is a strong correlation with eating a whole foods diet and just better energy and more consistent energy throughout the day. And I found just greater ability to focus and concentrate. And so many people now are relying upon energy drinks and stimulants and Adderall and things like that. And I think it's important that we have this tool known as whole foods and exercise and sleep that can help to optimize our metabolic health and help us focus and concentrate and have better mood and well-being. So I wanted to share this with you because it's really interesting here, especially this correlation with the inability to concentrate and fasting glucose levels, as well as severe and major depression symptoms and fasting glucose levels. And so if you know someone in your life that is anxious, depressed, and or has a hard time focusing, please share this with them. And so this article was, again, recently published on the 25th of March, 2024 in the Journal of Affective Disorders. One more time, the title is Association Between Depressive Symptoms and Prediabetes, the NHANES 2007 to 2016 findings. Again, finding that major depression, inability to focus, and severe depression are linked with impaired fasting glucose levels. And based upon data that we've covered in past videos, about 96% of US adults have poor metabolic health. And I'm sorry, 94%. Only 6% of us are optimally metabolic healthy. So it makes sense that mental issues and inability to focus are quite high because there is this association. So I wanted to share this with you. Please share the message that eating real food, exercising, balancing sleep will help with your mental health as well. We'll catch you on a future episode down the road. Appreciate your likes, your comments, your shares. Until then, we'll catch you later.